Welcome to Pharmacology Insights, where we break down complex pharmacology into simple, easy-to-understand concepts. When we talk about the side effects of antipsychotics, movement disorders often get the spotlight. But there's another common yet often overlooked side effect: hyperprolactinemia. It's a condition where the body produces too much prolactin, a hormone involved in lactation and reproductive health. Why do antipsychotics trigger this hormonal imbalance? Let's take a closer look. Prolactin is a hormone produced by the anterior pituitary gland. Its main role is to stimulate breast development and milk production in females, but it affects men too. When levels get too high, it can lead to menstrual irregularities, sexual dysfunction, infertility, gynecomastia, and even galactorrhea, which is milk production outside of pregnancy. So, why is a psychiatric medication messing with a reproductive hormone? Here's the key: dopamine inhibits prolactin. In the brain, there's a pathway called the tuberoinfundibular pathway, which connects the hypothalamus to the pituitary gland. Dopamine released from the hypothalamus acts like a brake, binding to D2 receptors on lactotroph cells in the pituitary, keeping prolactin levels under control. Now enter the antipsychotics. Most antipsychotics, especially the typical and some atypical or second-generation ones, work by blocking D2 dopamine receptors in the brain. This helps control psychosis, because blocking dopamine activity in the mesolimbic pathway reduces symptoms like hallucination and delusions. But remember, antipsychotics don't only block dopamine in the mesolimbic system. They also block D2 receptors in the tuberoinfundibular pathway. And when that inhibition is removed, prolactin levels go up, somewhat dramatically. Elevated prolactin levels can lead to a range of concerning symptoms. In women, this may include missed periods, fertility issues, or unexpected lactation. Men might notice a drop in libido, erectile dysfunction, or breast enlargement. Over time, prolonged hormonal imbalance in either gender can lead to reduced bone density, driven by lower levels of estrogen or testosterone. These side effects often go unaddressed. Patients may hesitate to bring them up, and healthcare providers might overlook them during consultations. But awareness is crucial. Not all antipsychotics affect prolactin equally. Higher-risk drugs include risperidone, paliperidone, amisulpride, and typical antipsychotics like haloperidol. These have strong D2 blocking activity in the tuberoinfundibular pathway. Lower-risk drugs include clozapine, quetiapine, and aripiprazole. This is partly due to their weaker or more transient D2 receptor binding. Interestingly, aripiprazole is a partial D2 agonist, so it can even help lower prolactin levels in some cases. If a patient starts showing signs of hyperprolactinemia, there are a few important steps clinicians can take. First, check serum prolactin levels to confirm the diagnosis. Next, consider switching to a lower-risk antipsychotic. Aripiprazole is often a good option. And if the symptoms are severe or don't go away, referral to an endocrinologist may be needed. At the end of the day, it's all about finding the right balance, which is to manage mental health without compromising hormonal health. To recap, dopamine inhibits prolactin through the tuberoinfundibular pathway. Antipsychotics block D2 receptors, lifting that inhibition. The result? Increased prolactin, or hyperprolactinemia. Some antipsychotics are more likely to cause this than others. And yes, there are ways to manage it. So next time when you think about antipsychotic side effects, don't forget the endocrine system. Sometimes, what's happening in the brain ends up affecting the body in unexpected ways. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.